Thursday, October 17, 2013, Harvey Singer, a 59-year-old father of two young men in Rochester, New York, would have never guessed he'd face the same breast cancer battle as his sister and mother had several years before him. But in 2008, at age 54, Singer learned he had stage 1 breast cancer, a diagnosis that sent him on a foray into a healthcare system that often overlooks and isolates this particular male patient population. Most of us think breast cancer is a woman's disease, and for decades, efforts to raise consciousness and find a cure have been literally colored pink. In the culture of breast cancer, patients and survivors of the disease form a sisterhood, a supportive female community that bonds over a rose-colored narrative, which begins with screening and diagnosis and ends, hopefully, with survival. Because of this, breast cancer, pink-washing, advocacy groups, and the medical community sometimes seem to forget that men can develop breast cancer as well. In the United States, one man is diagnosed with breast cancer for every 100 women, making the disease relatively rare for men. Unfortunately, though, men are often diagnosed at a later stage than women, when their breast cancer has become more aggressive and is more likely to spread to other parts of the body. It's estimated that 2,240 U.S. men will have been diagnosed with breast cancer by the end of 2013, and just a little over 400 men will have died from the disease according to the National Cancer Institute. Breast cancer is the most common cancer among women after melanoma. In 2013, there will be more than 200,000 new breast cancer diagnoses and nearly 40,000 deaths from breast cancer among women. Doctors don't have a specific way to treat male breast cancer, learned Singer, who has also been that was detected a year and a half after he had been treated for breast cancer. They just go with what they know, which is how to treat a woman, and they're not sure whether it's going to work or not, but they do it anyway. In response to his experience with diagnosis and treatment, in 2009 Singer founded his Breast Cancer Awareness, an advocacy organization for men with breast cancer. His aim is to educate men about their breast cancer risks and help them get the best treatment possible. BRCA and other breast cancer risks for men. Singer had become aware that he was at risk for certain cancers when his sister was diagnosed with breast cancer and tested positive for the BRCA2 gene mutation, which puts women at higher risk for breast and ovarian cancer, increases a man's risk for prostate and breast cancer, and also raises pancreatic cancer risk for both genders. They warned me about prostate cancer but they never once talked about breast cancer, said Singer. I don't think the medical community thinks about male breast cancer as much as they should, or at all. Though Singer's breast cancer was due to the BRCA mutation, the gene is not the sole risk factor for male breast cancer. Sharon Giordano, MD, professor of medicine at MD Anderson Cancer Center in Houston, explained that men who have Klinefelter syndrome, a chromosomal condition in which they do not produce enough testosterone, are also at higher risk for breast cancer. In addition, men who have been exposed to radiation or are obese are at higher risk. But overall, the factors that determine why a man develops the condition are still mysterious. Giordano said, in most situations, we don't really have an understanding of the etiology, said Giordano, who is involved in a large international study looking at similarities and differences in male and female breast cancers in more than 1,200 patients. Symptoms. Men shouldn't ignore. Singer first experienced breast cancer symptoms 3 months before he saw his doctor. He noticed changes in his left breast that included irritation, nipple indentation, and a hard lump he could feel when he pressed down on his chest. He thought the changes were simply the result of a pulled muscle or due to age. It wasn't until a friend Singer hadn't seen for some time gave him a hug and he felt a shooting pain through his left breast that radiated to his shoulder that Singer went to the doctor. A mammogram revealed a mass in his left breast, while an ultrasound showed calcification, which is commonly found in tumors. A biopsy confirmed the speculation. Singer had breast cancer. He underwent a full mastectomy of his left breast. Mastectomies, rather than lumpectomies, typically are performed on men because their tumors tend to be closer to the nipple, explained Giordano, which means that cosmetically, mastectomies make the most sense. Singer went into the operation fearful that doctors might discover that the cancer had made its way to his lymph node system. To me that was the biggest fear of surgery, he said. It wasn't so much that I would wake up and be a one-breasted man. He opted not to have reconstructive surgery because he didn't want to undergo any more surgery.